mind that you cannot see all of the vessels that you need to identify on here. Some are not visible, so I'm just going to show you what is visible. So let's start here. Here's your heart. This is the ascending aorta, aortic arch, of course, and then it goes descending aorta. Now, the descending aorta essentially is all of this, but you can call it different things in different areas. So as it goes down here, when it's in the thoracic area, even though we can't see it, that would have been thoracic aorta. Then when it's down here, this would be abdominal aorta because it's in the abdominal cavity. But it's all descending. So let's go back here to the branches off of the aortic arch. This first branch you already learned is the brachiocephalic. And then the middle branch was the left common carotid, and then this branch was the left subclavian. So let's go back to the brachiocephalic, which most of it's hidden by this portion of the pulmonary artery. As soon as it branches, it becomes two different things. So this would be the right common carotid, which they go up to the head. And then the other branch is the right subclavian. Yep, good. Right subclavian. Okay, so we already had this one as our left common carotid. The carotids will then branch into internal and external. So primarily what you're seeing here is just external because it's on the outside of the body, outside of the head. That's all external. But there is an internal, which you can't really see, that would go inside the skull to get to the brain and the eyes. But you can't see that. Okay, so this is just going to be external carotid. Now, to our subclavian. The subclavian comes down here until it gets to the armpit area. Okay, and once you are here, now it's called the axillary. Okay, this is axillary artery. And then when you continue and go down by the arm, you call it brachial artery. Now, at the elbow, now it's going to branch. Now, this arm is in anatomical position, but this one is not. He's flip-flopped. So I'm going to go over here to this side, because you can see it very clearly. So brachial artery, then it branches. This outer branch, the lateral branch, is by the thumb, right? Because that's where the radius is. Radius hitch a ride is on the outside in anatomical position. So this would be radial artery. And then the inner one is by the ulna, so you call it the ulnar artery. Exactly. Yep, radial is going to be by your thumb. Now let's go back to this abdominal aorta area. I'm going to do the branches off of that. You have three major branches off of it. So at the very top, this one is the celiac trunk or celiac artery. The celiac artery or trunk has three separate branches that you need to know. 1, 2, 3. This first one to the right is called the common hepatic artery. Hepatic means liver. So it's heading to the liver. Then actually once you're inside the liver, which is this brown stuff, you just call it hepatic arteries and veins. But as you lead to it, it's called common hepatic. Then the one that goes up here, this is the left gastric. The stomach would have been here, it's removed. So that goes to the stomach, left gastric. And then this one is the splenic. Goes to the spleen. This is the spleen. So splenic. Okay, so this branch off the abdominal aorta is celiac trunk, which has common branches of the common hepatic, left gastric, and splenic. The next major projection off is the superior mesenteric. And then this bottom one is inferior mesenteric. So celiac artery or trunk, superior mesenteric, inferior mesenteric. Now, there is an additional thing that's coming off, directly off the abdominal aorta, and that is the renal arteries. Renal arteries go to the kidneys. Okay, renal arteries. Now, when we get down to the bottom, it branches. So as soon as you have branching, you call this the common iliacs. Yep, common iliacs. But then when it branches again, you're going to call it something else.
Internal.
Yep, this one going in would be the internal internal iliac. And then this part out here is the external iliac. Now, that continues until you leave the body cavity. Once you leave the body cavity, now you're in the thigh. And that is the femoral artery. Then you continue till you get to the back of the knee, which is called the popliteal. So popliteal is actually in the back of the knee, which you notice this guy actually has his foot out to the side, so I can see his back of the knee. Over here, this is not popliteal. Popliteal is actually behind it, but you can't see it there. So this is a better place. Popliteal. And then you go till it branches again. These are the tibial arteries. The one to the front is going to be anterior tibial. The one to the back is posterior tibial. Okay, that's what you need on this model. All right, I'll quiz you.
One question. Where's the lumbar?